I'm Emmett Reed, Executive Director of Florida Healthcare Association. Welcome to another edition of FHCA's Provider Program.
This is a Tallahassee update from the Florida Healthcare Association.
Week 2 of the legislative session was extremely busy for FHCA. The House Health and Human Services Committee took up their Medicaid reform bill, and Tony Marshall of our staff testified about a number of important protections that must be included to preserve nursing home resident quality care. The committee advanced the bill, including 2 items recommended during our testimony, and they appear receptive to working with us on incorporating more fixes. We continue to work with legislators on the Senate side to help them understand that their bill as written effectively cuts provider rates and threatens quality care for our state's most vulnerable seniors. We recognize the magnitude that managed care would have on our members and continue to work around the clock to address this issue on your behalf. As progress is made, FHCA will keep you updated. On Tuesday, FHCA took part in Ambassadors for Aging Day, where hundreds of seniors stopped by our booth at the Capitol to learn more about the associations, the members we represent, and the important work that you do. We held another successful Lobby Wednesday with nearly 100 long-term care professionals in town to speak with their legislators. Tuesday evening, over 50 employees from Gulf Coast Healthcare gathered for an update on our legislative priorities. I had a chance to speak with Gulf Coast President Craig Robinson about the critical messages they're sharing to lawmakers and the importance of being in this grassroots initiative. All right, I am here with Gulf Coast Healthcare President Craig Robinson. And Craig, first of all, welcome to Tallahassee. We are so glad you're here. And as president of such a large organization, you brought 40 plus people with you. Tell me what your thoughts are on Lobby Wednesdays and why you make that big of a commitment to the Florida Healthcare Association.
Well, I think it's vital. I mean, if you're not playing, then you're standing on the sidelines letting us do all the work for you. So we need some folks to come in and help with this commitment. We've got people that are very busy. You know, we run business, and they're taking their time to come here to see their legislators, to talk about the important issues that affect everybody. Mm-hmm. And so we need other people to come in and do the same thing we're doing. But no, it's invigorating for our folks. It's educational. They see what the things that they do on a daily basis are impacting what happens in Tallahassee. Right. So they're the boots on the ground. They're the ones who are going to have to implement anything that happens here.
Also in town were members from FHCA's District 9 in Jacksonville, as well as representatives from Consulate Healthcare and the Pines of Sarasota. They could be seen throughout the Capitol, meeting with legislators and their staff and taking part in some important committee meetings. I caught up with John Overton, president of the Pines of Sarasota, who spoke about the message he and his staff were sharing with their local legislators. All right, I'm at the Capitol with Paul Hartman and John Overton, both with the Pines of Sarasota, for a Lobby Wednesdays. Of course, John, past president of FHCA, and Paul, a very active member. We're so glad that both of you could make it. First of all, John, let's start with you. As a past president of the association, continually involved in your time working in this profession, tell me the benefit of FHCA that you see, in particular as it regards to governmental affairs and lobbying, etc.
As far as I'm concerned, Emmett, it begins and ends with Florida Healthcare Association. I cannot even begin to understand why any individual involved in nursing homes, assisted living facilities would not choose to be involved. It's got to be. You guys are actively involved up here. We've done this year over year. We thought that 2001 was a difficult time. This is a very perilous time for the profession right now. We need all the help we can get. We're glad to be here.
Well, we certainly appreciate all that you've done for the association, continue to do, and that you take the time to drive all the way up from Sarasota to help us out. And now, Paul, you're famous. Yeah, you know, John's a famous past president. You're famous for a saying that you coined when you talked about how, you know, the legislature can cut 5% in transportation or in nursing homes if they have their choice. So talk a little bit about your thought process in coining that phrase.
Well, the thought process goes this way. If you have to save 5% in the transportation budget, you build 5% less roads. We have a nursing home where we're operating with a fixed number of staff, a fixed number of residents, and if we have to cut 5%, we have to decide what services we can't provide. And it's not as easy as just not building a section of road. And so we're faced to look at every single thing we do to save that 5%.
Well, and I think the biggest the biggest observation there is a road is a road. A cut to a nursing home is a cut to human beings. Also this week, House Bill 119 by Representative Matt Hudson passed through its first committee, but not without debate. This bill contains important deregulations for nursing homes, including the elimination of outdated reports required under state law which duplicate federal regulations. It's important to understand that this bill does not weaken the Agency for Healthcare Administration's authority to inspect or sanction licensed providers. Instead, it will enable caregiving staff to spend more time at the resident's bedside and give regulators more time to spend on meaningful review of provider services. We're also keeping a close eye on the budget process as legislators continue to struggle with ways to fill our state's nearly $5 billion shortfall. While we're waiting for the proposed budgets to be unveiled by the House and Senate, we're working hard to educate lawmakers of the drastic effects that Medicaid funding cuts would have on your residents and your staff and the quality of care your nursing home provides.
I mean, at the end of the day, none of us want to put constraints on you or anybody else that's going to make it so that you can't run your business or that make it so it's unprofitable. If you're not profitable, you're going to go out of business, which means we're going to have a bunch of state-run, messed up nursing homes all over the state. We don't want that.
As always, the pace of session moves quickly, and your FHCA staff and lobby team continues to work tirelessly on your behalf. We encourage you to be part of the process and join us in Tallahassee for Lobby Wednesdays or whenever your schedule permits you to make it to the Capitol. To find out more about how you can get involved in FHCA's Lobby Wednesdays or to stay up to date on our legislative activities, visit the advocacy section on our website or follow our Capitol Connection legislative blog, both of which can be found at FHCA.org. Until next time, I'm Emmett Reed, keeping you informed about the critical issues that impact long-term care and the providers we represent.